When you preside in a treatment court and you're trying to help people overcome their substance abuse, uh, it's important to understand whether there are issues that led to their abusing substances. And trauma is one of the most common reasons why people turn to drinking and using drugs. People in treatment court in large numbers have suffered from various forms of trauma, whether it's been having been victims of domestic violence, rape, physical abuse, mental abuse. In young people, you see trauma from having lived in multiple foster care homes, having been moved from home to home during young ages. The violence in neighborhoods often creates trauma issues for individuals. People having seen friends of theirs killed, people having seen gunshot victims in their neighborhoods. So when people have suffered from trauma and they turn to abusing substances to numb themselves, not to feel the pain, if you're not aware of the cause of the substance abuse and you insist they stop using drugs, you leave them with no coping mechanisms to deal with the trauma. So once we became aware of that in the Brooklyn Treatment Court, and we became aware of it by assessments, and during assessments for mental health issues, we learned how many people, and many of them populations we didn't expect, young men, for example. Once we became aware of how many people had been victims of trauma, whether or not they actually meet the criteria for post-traumatic stress disorder, if they're victims of trauma, you need to provide them with treatment that is trauma expert. The court itself needs to be trauma informed, but they need to get best practices treatment that will deal with those underlying issues of trauma. Well, drug court is theater, so a lot of what we do in drug court is designed to teach not just the participant, but the audience. So you want the audience to see that someone is doing well and is being recognized by the judge. That kind of positive reinforcement leads others to say to themselves, wow, if I do that, then the judge is going to be smiling at me, shaking my hand, decreasing my treatment days. So I'm going to work harder so that I can accomplish that. But in the same way, you want people to see what happens to individuals who are not complying with the treatment mandate. That person is not going to treatment, the judge just yelled at them, that person was just sent to jail for a weekend because they relapsed and were dishonest about it. So that's part of the learning experience in drug court, teaching consequential thinkings. Well, when you're dealing with individuals who are trauma survivors, if you're not aware of that fact, you can unintentionally re-traumatize, both in the way you speak to them and in the actions you take in court. So for example, if I'm sanctioning someone to an overnight or a weekend in jail, the audience and the individual all see the theater in that. They see, as I'm yelling at someone, the court officers go behind them, persons put their hands behind their back, and they're led off to, we have a door that leads to the jail cells. If you have somebody who is a survivor of trauma, perhaps their traumatic experience was being restrained, so that if a court officer simply reaches over and grabs that person and puts their hands behind their back, the individual may react because they feel that they're being restrained. So not just the judge, but all of the people in the courtroom need to be trauma informed. So my court officers know to say to an individual, you know, the judge has just remanded you, I have to touch you, I'm going to have to put your hands behind your back, and before they touch them, before they take any action towards that person's person, they let them know what's happening. There are other things that you may not think about in a treatment court that you say to participants that you really need to be careful about not saying to somebody who has a mental health problem, such as trauma. If someone's being treated by a mental health specialist for trauma, you don't want to say, you know, did you take your pills today? Are you taking your, you know, crazy meds? That's what people will hear it as. They'll hear it as, oh, the judge thinks I'm crazy and I really can't be fixed. So if you say, you know, I understand you're seeing a doctor and he's prescribed some medication, is everything okay with that? It gives a person a chance to say, well, I really don't like the side effects I'm having. And you can have a real conversation about what they can do about using those medication and sharing the side effects with the doctor rather than simply stop taking them. So being a trauma-informed court changes much of the things that we do in court. It may change sanctions. There may be somebody who, because of a trauma history, who has that feeling of hopelessness. If I would put them in jail, they will feel, and I've had people say it to me, they'll come back from a weekend in jail and say, you know, Judge, you were right. I belong there. Don't let me out. I'm just not going to be able to do it. Well, the lesson that I had hoped was the person would come back and say, I hated it there. I don't want to be there. You know, what do I have to do to make sure I never go back? So if you have somebody with that kind of trauma history where you're afraid that a jail experience might feed into their feelings of hopelessness, you need to moderate the amount of time you're using jail. You need to explain it, what the purpose of it is. It may be that I need to put you in jail so that you'll be safe over the weekend, because there's nowhere that you can go right now where you're going to be safe, and because you haven't taken your medication and you don't have a prescription for it, I need you to be in a safe place where a doctor's going to be able to give you your medications. That's a very different message than you messed up, you're going to jail. So the words I use are different because of viewing people through that lens of trauma. And it's not going to harm anyone if I use that language and they actually have not been a survivor of a trauma, or if they're particularly resilient and they don't need those words are not going to be harmful. Those words really just treat people with dignity and respect and let them know that we view them as a person with opinions and ideas and the ability to control their future.